Listen to me carefully, because what I'm about to share with you today comes from years of clinical observation, thousands of consultations with women just like you, and scientific evidence that most people simply don't want to hear. By the end of this conversation, you're going to understand why the way you approach self-pleasure might be reinforcing the exact emotional patterns that have kept you stuck in relationships that drain you, why your nervous system is learning all the wrong lessons during your most intimate moments, and what you can do starting today to rewire decades of conditioning that has taught you to prioritize everyone's satisfaction except your own. Stay with me until the very end, because I'm going to reveal the one cognitive mistake that turns something as natural and healthy as masturbation into a training ground for emotional dependency and relational anxiety. Before we go any further, I need you to do something for me. Subscribe to this channel right now, because the content I share here isn't something you'll find in your typical women's magazine or wellness blog. This is clinical truth delivered with compassion. And tell me in the comments below if anyone has ever told you that you were too strong to love, too independent to need anyone, or too much of anything that made you feel like your authentic self was somehow wrong. I want to hear your story. Now let me paint you a picture. Her name was Rebecca, though of course that's not her real name. She came into my office 3 years ago, 52 years old, recently divorced after 26 years of marriage, successful in her career, accomplished in every external measure, and utterly lost when it came to understanding her own body and her own pleasure. During one of our sessions, as we explored patterns of emotional suppression and relational sacrifice, she said something that stopped me in my tracks. She told me that even when she was alone, even in the privacy of her own bedroom, with no one to perform for and no one to please, she found herself rushing through self-pleasure as if it were another item on her to-do list, something to complete quickly so she could move on to the next responsibility. What Rebecca didn't realize at the time, what so many of my patients don't realize, is that the way we approach our own bodies when no one is watching reveals everything about how we've been programmed to exist in the world. Your relationship with self-pleasure is not separate from your relationship with self-worth. The neural pathways you activate during masturbation, the thoughts you allow yourself to think, the permission you grant yourself to take time, to go slowly, to focus on sensation rather than outcome, all of this is teaching your nervous system what you deserve and what you don't. Let me explain this from a medical perspective, because I want you to understand the neuroscience behind what I'm saying. When you experience pleasure, whether alone or with a partner, your brain releases a cascade of neurochemicals including dopamine, oxytocin, and endorphins. Dopamine drives motivation and reward. Oxytocin creates bonding and connection, and endorphins provide that sense of well-being and relief. But here's what most people don't know. The context in which these chemicals are released matters tremendously. Your brain doesn't just learn that touch feels good. It learns a complete emotional narrative around that touch. If you masturbate while feeling guilty, while rushing, while thinking about someone else's needs, while consuming content that doesn't actually align with your authentic desire, but rather with what you think you should desire, you're not just having a physical experience. You're encoding a message deep into your limbic system that says, your pleasure is secondary, your time is not valuable, your authentic desire doesn't matter. And satisfaction should be achieved as quickly and efficiently as possible so you can return to being useful to others. Does that sound familiar? Because it should. It's the same pattern that shows up in your relationships, in your work, in how you schedule your days, and how you respond to other people's demands on your time and energy. I've spent 15 years working specifically with women in midlife, women who are navigating the complex terrain of hormonal changes, relational transitions, identity shifts, and the profound question of who they are when they're no longer defined primarily by their roles as partners, mothers, or caretakers. What I've observed consistently is that the women who struggle most with establishing boundaries, with recognizing their own worth, with leaving relationships that no longer serve them, are often the same women who have never given themselves permission to explore their own pleasure slowly, deliberately, and without the lens of performance or external validation. This isn't a coincidence. This is neurobiology meeting psychology meeting cultural conditioning, and it creates a perfect storm of self-abandonment that plays out in every area of your life. Think about how you were taught to think about masturbation. If you were taught anything at all, which many women in your generation were not, most likely the message you received was some combination of shame, silence, and the implication that good women don't touch themselves, that sexual pleasure is something that happens in the context of a relationship and is primarily for someone else's benefit. Even if you intellectually rejected these messages, even if you consider yourself progressive and sex-positive, I can almost guarantee that some residue of this conditioning lives in your body and influences your behavior in ways you haven't fully examined. I had a patient named Gloria, 58 years old, who told me she had never in her life masturbated without feeling like she was doing something wrong, even though rationally she knew it was healthy and normal. The guilt had been installed so early and so deeply that it had become automatic, a background program running constantly beneath her conscious awareness. What fascinated me about Gloria's case was that she could trace a direct line between this guilt around self-pleasure and her pattern of staying in a marriage where she was consistently criticized and controlled. Her body had learned that her own desire was shameful, and this belief had shaped every relational choice she made for 4 decades. When we finally worked through this pattern, when Gloria gave herself permission to explore her own body with curiosity rather than shame, with slowness rather than efficiency, something remarkable happened. She started noticing other areas of her life where she had been operating from the same script of self-denial and performance. She started speaking up in situations where she previously would have stayed silent. She started recognizing when people were taking advantage of her generosity. She eventually left that marriage and built a life that actually reflected her values and her desires. Now, I know what some of you are thinking. You're thinking this sounds dramatic, that I'm making too much of something that's private and personal and not really anyone else's business. But here's the thing. Nothing about how we treat ourselves is truly private, because how we treat ourselves becomes the template for how we allow others to treat us. Let me share with you what happens in your brain during sexual arousal and climax, because understanding the biology will help you appreciate why this matters so much. When you begin to experience arousal, blood flow increases to your genitals, your heart rate elevates, and your prefrontal cortex, the part of your brain responsible for executive function and self-criticism, actually decreases in activity. This is why sexual pleasure can feel like such a relief, such an escape from the constant mental chatter that usually dominates your consciousness. For a brief window of time, you're more connected to sensation and less connected to judgment, but the decrease in prefrontal activity doesn't mean your brain stops learning. In fact, during states of heightened arousal and pleasure, your brain is in a particularly plastic state, meaning it's exceptionally receptive to encoding new associations and strengthening existing neural pathways. Whatever you're thinking about, whatever emotions you're experiencing, whatever narratives you're telling yourself during this time, your brain is absorbing all of it and filing it away as part of your sexual identity and your sense of self. This is why the question of what you do during masturbation matters so much. Are you present with your own sensations, or are you disconnected and focused on fantasy? Are you giving yourself permission to take your time, or are you rushing toward climax as if someone might catch you doing something wrong? Are you exploring what genuinely feels good to your body, or are you replicating what you think should feel good based on external messages about female sexuality? There's no moral judgment in any of these questions. I'm not suggesting there's a right or wrong way to experience pleasure. What I am suggesting is that awareness matters and intentionality matters, because unconscious patterns have a way of running your life when you're not paying attention. One of the most damaging things I see women do during masturbation is something I call performative self-pleasure. This is when you masturbate not primarily for your own enjoyment, but as a kind of rehearsal for partnered sex, or as a way to maintain your sexual identity, or because you've been told it's healthy and you're checking a box. The problem with performative self-pleasure is that it reinforces the exact dynamic that has caused so much harm in your relational history. The idea that your value lies in how well you perform sexuality rather than in your authentic experience of your own body. I had a patient, I'll call her Diana, who came to me at 54 struggling with severe anxiety and a pattern of choosing emotionally unavailable partners. During our work together, she casually mentioned that she masturbated frequently, but never actually enjoyed it very much. When I asked her to tell me more about this, she described a process that was almost entirely mental, focused on elaborate fantasies that had very little to do with her own physical sensation, and everything to do with being desired by an imaginary partner who found her irresistible. Can you see the pattern here? Even alone in her bedroom, Diana couldn't access her own pleasure without filtering it through someone else's imagined desire for her. Her worth, even in her most private moments, was contingent on being wanted rather than on wanting. This is what I mean when I say that how you masturbate teaches your nervous system what you believe you deserve. As we worked together, Diana began to experiment with something radically different. Touching herself slowly, without any particular goal, paying attention to sensation rather than story, allowing herself to notice what actually felt good to her body rather than what she thought should feel good. This was profoundly uncomfortable for her at first. She told me it felt boring, that her mind kept wandering, that she felt silly and self-conscious even though she was completely alone. But gradually, over weeks and then months, something shifted. She started to enjoy the experience. She started to feel more connected to her own body. And perhaps most importantly, she started to notice when men she was dating were treating her as a fantasy rather than as a person, and she found herself no longer willing to accept that dynamic. This is the power of changing your relationship with self-pleasure. It's not about having better orgasms, although that often happens. It's about teaching your body and your brain that you are the primary source of your own worth, that your pleasure matters, that you don't need to perform for anyone including yourself, and that taking time for your own satisfaction is not selfish but essential. Now I want to talk about something that many women struggle with but few people discuss openly: the use of fantasy during masturbation, and what that fantasy reveals about your emotional conditioning. Fantasy itself is not problematic. Our brains are designed for imagination, and sexual fantasy can be a healthy part of sexual expression. But the content of your fantasy and your relationship to that fantasy can reveal patterns that deserve your attention. I've worked with countless women who find that their sexual fantasies involve scenarios where they are powerless, where they are being dominated or even degraded, where their pleasure is entirely dependent on someone else's desire and control. Again, I want to be clear. I'm not here to shame anyone's fantasy life. What happens in your imagination is your business. But I do think it's worth asking yourself why these particular fantasies are arousing to you, especially if they don't align with what you would actually want to experience in reality. Often, these fantasies are eroticizing exactly the dynamics that have caused pain in your actual relationships. If you grew up learning that your worth came from being desired by men, if you were praised for being accommodating and criticized for being assertive, if you absorbed the message that female sexuality is inherently passive and receptive rather than active and desiring, then it makes perfect sense that your erotic imagination would reflect these patterns. Your brain has learned to associate submission and powerlessness with safety and approval, and it has wired those associations into your sexual response. This is where the neuroscience gets really interesting. Remember how I mentioned that your brain is particularly plastic during states of arousal? Every time you masturbate while entertaining fantasies that reinforce your lack of agency, you're strengthening the neural pathways that connect pleasure with powerlessness. You're literally training your brain to find satisfaction in scenarios where you have no control and where your own desire doesn't matter. Then you wonder why you keep choosing partners who disregard your boundaries and why you struggle to advocate for yourself in relationships. The solution isn't to force yourself to have different fantasies or to shame yourself for the ones you have. Shaming yourself just adds another layer of self-abandonment to an already problematic pattern. The solution is awareness and gradual experimentation with bringing more of your authentic self into your private moments. What would it be like to masturbate while imagining a scenario where you are powerful, where you are actively choosing pleasure rather than receiving it as a gift from someone else, where your desire is central rather than peripheral? For many women, this feels almost impossible at first. They can't even conceive of such a scenario because it's so far outside their conditioning, but with practice, it becomes possible, and with more practice, it becomes natural. I want you to understand something crucial here. Sexual arousal is not just a physical response, it's a complex interplay of body, emotion, memory, and meaning. The contexts in which you've experienced arousal throughout your life have shaped what your body recognizes as erotic. If the primary context for your sexual development was one of performance, approval-seeking, and self-denial, then these elements may have become erotically charged for you, even though they are psychologically harmful. This is what I call trauma bonding at the neurological level. Your brain has learned to pair pleasure with patterns that undermine your well-being, and now those patterns feel necessary for satisfaction. Breaking this association requires patience, self-compassion, and a willingness to tolerate the discomfort of arousal patterns that feel different and unfamiliar. Let me tell you about Margaret, a patient who came to me at 62 after her second divorce. Margaret had spent her entire adult life in relationships where she was the caretaker, the fixer, the one who managed everyone's emotions and anticipated everyone's needs. She was exhausted and lonely despite decades of partnership. When we explored her sexual history, she revealed that she rarely masturbated, and when she did, it was always late at night after everyone else was asleep, quickly and quietly, and always with a sense of stealing something that didn't belong to her. I asked Margaret what would happen if she gave herself permission to masturbate during the day, to take her time, to use her voice, to experiment with sensation without any goal of orgasm. She looked at me like I had suggested she walk naked through her neighborhood. The idea of claiming that kind of space and time and attention for herself felt not just uncomfortable, but almost transgressive, like she would be violating some fundamental rule about what good women do. Over many months of therapeutic work, Margaret gradually began to reclaim her relationship with her own body. She started with small experiments, touching herself in the morning rather than late at night, allowing herself to make sounds, exploring different sensations without rushing to climax. What she discovered shocked her. She realized that she had spent 62 years believing that her body existed primarily for other people's pleasure and utility, and that even in her most private moments, she had never fully belonged to herself. As Margaret changed her relationship with self-pleasure, everything else in her life began to change as well. She started saying no to requests that didn't serve her. She started asking for what she wanted rather than waiting for others to read her mind. She started recognizing when people were taking advantage of her kindness, and she started protecting her energy. Most remarkably, she told me that she felt she was finally meeting herself for the first time, and that the woman she was meeting was someone she genuinely liked. This is what I want for you. Not just better sex or more orgasms, although those things are wonderful. What I want is for you to use your private moments of pleasure as an opportunity to practice being the primary person in your own life, to experiment with what it feels like to matter to yourself, to train your nervous system to recognize that your satisfaction is valuable and that taking time for yourself is not selfish but necessary. Now let's talk about something that affects many women in your age range but doesn't get discussed nearly enough: the impact of hormonal changes on sexuality and how this intersects with long-standing patterns of self-abandonment. As you move through perimenopause and into menopause, your body undergoes significant hormonal shifts that affect your sexual response. Estrogen levels decline, which can lead to vaginal dryness and changes in genital sensitivity. Testosterone, which plays a crucial role in sexual desire for women as well as men, also decreases. These changes are normal and expected, but they can be distressing, especially if you've already internalized shame around your sexuality. What I see in my practice is that many women respond to these changes by simply accepting that their sexual life is over, that decreased desire and increased discomfort are just inevitable parts of aging that must be endured silently. This resignation is tragic because it's based on incomplete information and cultural myths about female sexuality. Yes, hormonal changes affect sexual response, but they don't end it. And there are many effective interventions available, including hormone replacement therapy, vaginal moisturizers, and pelvic floor physical therapy. But here's what's crucial. If you've spent your entire life disconnected from your own pleasure, if you've never learned to advocate for your own satisfaction, if you've never given yourself permission to explore what feels good to your changing body, then you're much less likely to seek out these interventions and much more likely to simply accept dissatisfaction as your fate. This is another reason why your relationship with masturbation matters so much. Self-pleasure during midlife is not just about maintaining sexual function, although that's important. It's about maintaining your connection to your own body as it changes, about learning what brings you pleasure in this phase of life rather than assuming that what worked at 30 will work at 55, about refusing to accept the cultural narrative that older women are asexual beings whose desire doesn't matter. I had a patient named Sylvia who, at 59, had completely given up on sexual pleasure. Her marriage had become sexless years earlier, and she had accepted this as simply what happens. When I asked her if she masturbated, she looked almost offended by the question. She told me that she had tried a few times after her sex life with her husband ended, but it didn't work the way it used to. It took longer and required more effort, and she decided it wasn't worth it. Can you hear the pattern in this? Sylvia had learned that pleasure should be easy and quick, or it's not worth pursuing, that if her body didn't respond exactly the way it used to, then something was wrong and she should just give up. She had never learned that bodies change, that pleasure changes, that what feels good at 59 is different from what felt good at 29, and that this doesn't make it less valuable, just different. Working with Sylvia involved helping her reframe her entire approach to sexuality. Instead of treating orgasm as the goal and anything less as failure, we explored the concept of pleasure for its own sake, of touch and sensation and connection to her body without any particular destination. We talked about the medical realities of aging and the interventions available. Most importantly, we worked on dismantling her belief that investing time and attention in her own pleasure was somehow narcissistic or frivolous. Gradually, Sylvia began to explore her body again, this time with curiosity rather than expectation. She experimented with different types of touch and different contexts. She used vaginal moisturizers and eventually started hormone replacement therapy. She discovered that while her body did respond differently than it had in her younger years, it was still capable of significant pleasure, and that this pleasure made her feel more alive and more connected to herself than she had felt in decades. Here's something else I need you to understand about the neuroscience of pleasure and why it matters for your overall well-being. When you experience sexual pleasure and orgasm, your brain releases oxytocin, often called the bonding hormone. In partnered sex, this oxytocin creates attachment and connection between you and your partner. But oxytocin doesn't only work in partnered contexts. When you experience pleasure alone, you're releasing oxytocin that creates attachment and connection to yourself. Think about what this means. Every time you masturbate in a way that honors your own desire, takes your own time seriously, and prioritizes your own sensation, you're literally strengthening the neural pathways of self-connection and self-worth. You're teaching your brain that you are someone worth bonding with, that your company is valuable, that you deserve care and attention and pleasure. Conversely, every time you rush through self-pleasure guiltily, every time you focus on fantasy that erases your own agency, every time you treat masturbation as something shameful to get over with quickly, you're reinforcing neural pathways of self-abandonment and shame. You're teaching your brain that you are not worth the investment of time and attention, that your pleasure is secondary or doesn't matter at all. This is not an exaggeration. This is basic neuroscience. Your brain learns from repetition and emotional association. Whatever you repeatedly do while in a heightened emotional or physiological state becomes deeply encoded in your neural networks. If you want to change the fundamental patterns that have kept you stuck in unsatisfying relationships and compromising situations, you have to change what you're teaching your brain during these moments of heightened neuroplasticity. Let me address something that I know many of you struggle with: the role of pornography and whether it's helpful or harmful for women. This is a complex question without a simple answer, because pornography exists on such a wide spectrum, from exploitative and degrading content to feminist and female-directed content that attempts to depict authentic pleasure and connection. My concern with pornography, regardless of where it falls on this spectrum, is that it can become another way of outsourcing your pleasure, of watching someone else's sexuality rather than inhabiting your own. I've had many patients tell me that they can only achieve orgasm while watching pornography, that without it they feel nothing, or they can't maintain arousal. When we explore this pattern, what I usually find is that these women have never really learned to connect with their own internal landscape of desire. They need external stimulation because they've never developed the neural pathways that connect them to their own body's signals and sensations. Again, I'm not suggesting that pornography is inherently bad or that you should never use it. What I am suggesting is that if you can only experience pleasure while consuming content created by and for someone else, you might be missing an opportunity to discover what your authentic desire actually looks like. What if you tried masturbating without any external stimulation at all? Just you and your body and your breath and your attention. What if you explored what arises naturally when you're not being directed by someone else's vision of what female sexuality should look like? For many women, this is terrifying because the answer is nothing arises naturally. They feel disconnected and bored, and their mind wanders and they give up. But this disconnection is not a sign that something is wrong with you. It's a sign that you've never been taught to connect with yourself, and that learning this skill will require patience and practice. I want to offer you a different approach to masturbation, one that's grounded in mindfulness and self-compassion rather than performance and goal orientation. The next time you have privacy and time, I want you to try this. Lie down comfortably and close your eyes. Spend several minutes just breathing and noticing the sensation of your breath moving in and out of your body. Don't touch yourself sexually yet. Just breathe and notice where your body makes contact with the bed or chair or floor beneath you. Notice the temperature of the air on your skin. Notice any sounds around you. Then, slowly, begin to touch yourself in ways that have nothing to do with sexuality. Touch your arms, your legs, your belly, your face. Notice the texture of your skin, the warmth of your hands. Stay curious about sensation rather than moving toward arousal. If your mind wanders, and it will, gently bring your attention back to the physical sensations you're experiencing. Only after you've spent significant time simply noticing and appreciating your body in this neutral way should you begin to touch yourself sexually. And when you do, maintain the same quality of attention. Don't rush toward orgasm. Don't worry about whether you're doing it right. Don't compare this experience to past experiences or to what you imagine other people experience. Just stay present with the sensations arising in your body moment by moment. You might not have an orgasm during this kind of exploration, and that's perfectly fine. The goal isn't orgasm. The goal is presence, connection, and the radical act of treating yourself as worthy of your own unhurried attention. If you practice this approach repeatedly, something remarkable will happen. You'll start to know yourself in a way you never have before. You'll start to recognize what you actually want, rather than what you think you should want, and this knowledge will change everything about how you show up in the world. I know some of you are wondering how this relates to partnered sex, because many of you are in relationships or hope to be in relationships, and you want to know if changing your relationship with masturbation will improve your sexual connection with a partner. The answer is yes, absolutely, but perhaps not in the way you expect. When you learn to be present with your own pleasure, when you learn to advocate for your own satisfaction, when you learn that your desire matters and deserves attention, you bring all of this learning into partnered contexts. You become less willing to fake orgasm to protect someone else's ego. You become more comfortable communicating what feels good and what doesn't. You become less focused on performing sexuality in a way that matches some external ideal and more focused on authentic connection and mutual pleasure. But here's what's crucial. You can only bring to a partnered sexual experience what you've learned in your own private practice. If you don't know what brings you pleasure, if you've never taken the time to explore your own body, if you're disconnected from your own desire, then you have nothing to share with a partner except performance and pretense. This is why I'm so passionate about women reclaiming their relationship with masturbation. It's not about sex. It's about self-knowledge, and self-knowledge is the foundation of everything else. I had a patient, I'll call her Louise, who came to me at 63 in a new relationship after being widowed for 5 years. She was nervous about being sexual with someone new after so many years with one partner. But what emerged in our conversations was that she had never been genuinely comfortable with her own sexuality, even in her long marriage. She had always focused on her husband's pleasure and had faked orgasm more often than not. Now, facing the possibility of sexual intimacy with a new partner, she was terrified that she would fall back into the same patterns of performance and dissatisfaction. We spent months working on Louise's relationship with her own body before she ever became sexual with her new partner. She practiced the kind of mindful self-touch I just described. She explored what genuinely brought her pleasure rather than what she thought should bring her pleasure. She worked through layers of shame and self-consciousness. And when she finally did become sexual with her new partner, she brought a completely different energy to the experience. She was present, she communicated clearly, she advocated for her own pleasure, and the sexual relationship that developed was more satisfying than anything she had experienced in her entire life. This is what's possible when you do the internal work first. This is why your private relationship with pleasure matters so much. You're not just learning to have better orgasms. You're learning to inhabit your own life fully, to claim your own experience as valid and important, to refuse the role of spectator in your own existence. Now, I want to address something that's particularly relevant for women who have experienced trauma, whether sexual trauma specifically or other forms of trauma that have impacted your relationship with your body and with pleasure. Trauma changes the nervous system in profound ways. It dysregulates your stress response, it impacts your ability to feel safe in your body, and it can create associations between arousal and danger that make sexual pleasure deeply confusing and distressing. If you have a trauma history, approaching masturbation as an opportunity for healing requires tremendous care and often professional support. You cannot simply force yourself to engage with your body sexually if that engagement activates traumatic memories or overwhelming emotions. This is not about willpower or determination. This is about respecting the wisdom of your nervous system, which is trying to protect you from perceived danger even when you're objectively safe. What I've seen work beautifully in my practice is a very gradual approach that prioritizes safety and control above all else. This might start with simply looking at your body in a mirror without touching, noticing what emotions arise and breathing through them. It might involve touching your body in non-sexual ways and learning to tolerate the sensations without dissociating. It might involve working with a trauma-informed therapist or somatic practitioner who can help you process stored trauma and gradually expand your window of tolerance for physical sensation. The goal is never to force yourself to be sexual if being sexual doesn't feel safe. The goal is to slowly, over time, reclaim your body as your own, to discover that pleasure is possible without danger, and to rebuild the neural pathways that trauma disrupted. This is deep work, and it cannot be rushed, but it is possible, and I have seen countless women move from complete disconnection from their bodies to genuine pleasure and embodiment through patient, compassionate, trauma-informed work. Let me be very clear about something. If masturbation triggers traumatic memories or overwhelming emotions for you, please seek professional help rather than trying to work through this alone. There are therapists who specialize in sexual trauma recovery, and they have tools and approaches that can support you in ways that reading an article or watching a video cannot. Your healing matters, and you deserve expert support in that process. For those of you who don't have a trauma history, but simply have decades of conditioning that taught you to disconnect from your body and prioritize others' needs over your own, the work I'm describing is still relevant but perhaps less fraught. You're not dealing with the neurological impact of trauma, but you are dealing with deeply ingrained patterns that have shaped your entire identity and way of moving through the world. These patterns won't change overnight. You can't simply decide to have a different relationship with your body and have it be so. Change requires repetition, patience, and a willingness to tolerate discomfort as you learn new ways of being. But every time you choose to approach self-pleasure with presence rather than dissociation, with curiosity rather than judgment, with slowness rather than efficiency, you're building new neural pathways and weakening old ones. Over time, these small repeated choices create fundamental shifts in how you experience yourself and your relationships. I want to talk now about something that might seem unrelated but is actually central to everything I've been saying, the concept of emotional regulation and how it connects to sexual pleasure. Emotional regulation is your ability to manage your emotional state, to tolerate difficult feelings without being overwhelmed by them, and to return to a state of calm and balance after stress or upset. This capacity develops in childhood through our relationships with caregivers, and for many women, particularly women of your generation, it didn't develop well because the adults around you were themselves dysregulated, or because emotional expression was discouraged or punished. What does this have to do with masturbation? Everything. Sexual arousal and orgasm are states of high physiological activation. Your heart rate increases, your breathing changes, your muscles tense and then release. For someone with poor emotional regulation, this level of physiological activation can feel dangerous or overwhelming. It might trigger anxiety or a need to shut down the experience before it becomes too intense. This is why so many women rush through masturbation or disconnect from the experience entirely. They're not comfortable with the level of activation that genuine arousal creates, learning to stay present with sexual pleasure. To tolerate increasing arousal without shutting it down or dissociating is actually a powerful form of emotional regulation practice. You're training your nervous system to handle high-intensity states without panic or numbing. This skill then generalizes to other areas of your life. You become more comfortable with strong emotions generally. You become less reactive and more able to respond thoughtfully rather than impulsively. You develop what neuroscientists call distress tolerance, which is the ability to handle discomfort without needing to escape it immediately. This is yet another reason why your private relationship with pleasure matters so much for your overall psychological health and relational functioning. You're not just learning about sex. You're learning fundamental skills of self-regulation that impact every aspect of your life. I remember working with a patient, I'll call her Patricia, who described herself as emotionally numb. She hadn't cried in years, she rarely felt excited about anything, and she described moving through life as if she were watching it happen to someone else. Patricia also mentioned that she occasionally masturbated, but felt nothing during the experience. No pleasure, no connection, just mechanical touch that eventually produced an orgasm that felt more like a sneeze than anything meaningful. What became clear as we worked together was that Patricia had learned very early in life that emotional expression was dangerous. Her mother was volatile and unpredictable, and Patricia survived her childhood by becoming very small and very quiet and very controlled. She learned to suppress all emotion, to disconnect from her body, to never draw attention to herself. This survival strategy had served her well as a child, but as an adult, it was strangling her. Patricia's sexual numbness was not a sexual problem. It was a manifestation of her global disconnection from feeling. Her body had learned to shut down all sensation because sensation was associated with danger. Working with Patricia involved helping her very gradually learn that feeling was safe, that she could tolerate emotion without being overwhelmed, that her body was no longer in danger even when she felt something strongly. This work included, but was not limited to, working with her sexuality. We did breathing exercises, body scans, gentle movement practices, and trauma processing work. But as Patricia began to reconnect with her body generally, her sexual experience changed dramatically. She began to actually feel sensation during masturbation. She began to experience pleasure not just as a genital response, but as a full-body experience. She cried during one of our sessions and told me she had finally come back to herself after decades of absence. This is the kind of transformation I want for all of you. Not just better sex, but a return to your own life, a reclamation of your own experience, a refusal to continue abandoning yourself in service of safety or approval or fitting in. Let me share with you some very practical guidelines for changing your relationship with masturbation in ways that support your overall psychological and relational health. First, schedule time for yourself. Don't wait until everyone else is asleep or until you happen to have a rare free moment. Put it on your calendar like any other important appointment. This communicates to your nervous system that your pleasure is a priority, not an afterthought. Second, create a context that feels good to you. This might mean lighting candles, playing music you love, taking a bath first, or any other element that helps you feel relaxed and present. Many women skip this step and just try to quickly masturbate in the same bed where they sleep, in the dark, as efficiently as possible. This reinforces the message that your pleasure is shameful and should be hidden. Treat yourself the way you would treat a beloved guest in your home. Third, start with breath and non-sexual touch, as I described earlier. Don't rush toward genital stimulation. Spend time connecting with your body as a whole, noticing sensation without any particular goal. This primes your nervous system for presence and connection rather than for performance and efficiency. Fourth, when you do begin sexual touch, go slowly, much slower than you think you need to. Notice what feels good, what feels neutral, what doesn't feel like anything at all. Stay curious rather than goal-oriented. If your mind wanders, and it will, gently bring your attention back to sensation. Fifth, practice having arousal without immediately moving toward orgasm. Let yourself build and plateau, and build again. This teaches your body that pleasure can be sustained rather than rushed toward a finish line. Many women have trained their bodies to climax as quickly as possible. And this pattern limits their capacity for pleasure. Learning to extend arousal and stay present with increasing intensity is a skill that improves with practice. Sixth, notice what you're thinking about during self-pleasure. Are you present with your own sensation, or are you telling yourself a story about being desired by someone else? Are you focused on how you look, or on how you feel? There's no need to force yourself to think differently, but bringing awareness to your thought patterns will help you understand what you've been unconsciously reinforcing. Seventh, after you finish, whether or not you've had an orgasm, take a few minutes to simply rest and notice how you feel. Don't immediately jump up and move on to the next task. This communicates that the experience matters, that you matter, and that taking time for yourself is valuable. These practices might seem simple, but they're actually quite radical for women who have spent their entire lives disconnected from their own pleasure. They require you to treat yourself as worthy of time, attention, and care. They require you to believe that your satisfaction matters. They require you to refuse the cultural narratives that have taught you that your body exists for others' pleasure or utility rather than for your own experience. I know that some of you are thinking that you don't have time for this, that you have too many responsibilities and too many people depending on you to spend 30 or 45 minutes on yourself. I want you to hear me when I say this. This is exactly the belief system that has kept you trapped in patterns of self-abandonment and relational dissatisfaction. The idea that everyone else's needs are more important than yours is not a fact. It's a story you've been told and have accepted, and it's a story that's costing you your life. You have time for what you prioritize. You make time for work, for caring for others, for countless obligations that you consider non-negotiable. Your own well-being, your own pleasure, your own connection to yourself should also be non-negotiable. Not because it's selfish, but because you cannot give from an empty well, and you cannot truly be present for others when you've abandoned yourself. I had a patient tell me once that taking time for herself felt like stealing, that she was constantly aware of all the other things she should be doing instead, all the people who might need her, all the responsibilities waiting for her attention. We worked together to reframe this belief. Taking time for yourself is not stealing. It's the basic maintenance that allows you to function. It's like sleeping or eating or breathing. You don't feel guilty about those things because you understand they're necessary. Your emotional and sexual well-being is equally necessary. As this patient began to prioritize her own needs alongside others' needs rather than beneath them, she was shocked to discover that nothing fell apart. The people in her life adjusted. They learned to meet some of their own needs. They respected her boundaries once she started enforcing them consistently. What she had believed was true, that she was indispensable and that everything depended on her constant availability, turned out to be a story rather than a fact. This brings me to one of the most important points I want to make today. Your discomfort with prioritizing yourself is not evidence that prioritizing yourself is wrong. It's evidence of how deeply you've been conditioned to believe that your needs don't matter. Discomfort is not the same as danger. Learning to tolerate the discomfort of putting yourself first, of taking time for your own pleasure, of refusing to immediately respond to others' demands, is essential work. Many women mistake discomfort for wrongness. They think that if something feels uncomfortable or unfamiliar, it must not be right for them. But growth always involves discomfort. Change always involves moving through unfamiliar territory. If you only do what feels comfortable, you'll never break free from the patterns that have limited you. I want to talk briefly about the role of age and aging in all of this, because I know many of you have internalized the message that women past a certain age are no longer sexual beings, that desire and pleasure are primarily for the young. This message is not only false, but profoundly harmful. Your capacity for pleasure doesn't have an expiration date. Your sexuality doesn't end at menopause or at 50 or at any arbitrary age that society has decided is past a woman's sexual prime. What is true is that sexuality changes as you age, just as everything else about your body and life changes. Hormonal shifts affect sexual response, physical changes impact sensation, and life circumstances shift priorities and availability. But change is not the same as ending. Many women actually report more sexual satisfaction in their 50s and 60s than they experienced in their younger years, precisely because they've become more comfortable with themselves, less concerned with performance, and more willing to advocate for their own pleasure. The question is not whether you're too old for sexual pleasure. The question is whether you're willing to explore what sexual pleasure looks like for you now, in this body, at this stage of life, rather than comparing yourself to who you were decades ago or to cultural images of sexuality that have nothing to do with your reality. I have worked with women in their 70s and 80s who are discovering their sexuality for the first time, who are finally giving themselves permission to explore their own bodies and their own desire after decades of suppression or performance. It's never too late. Your body is capable of pleasure at any age if you're willing to meet it where it is, rather than where you wish it were. Now let me address what might be the most important question of all. What would change in your life if you truly believed that your pleasure mattered? Not just intellectually acknowledged this idea, but viscerally believed it in your body and acted from this belief? What relationships would you leave? What boundaries would you enforce? What opportunities would you pursue? What would you stop tolerating? What would you start asking for? This is the question I want you to sit with after we finish today. Because the work I'm describing around masturbation is not really about sex at all. It's about identity, worth, agency, and the fundamental question of whose life you're living. Are you living your life, or are you living some version of what you think you're supposed to be based on others' expectations and judgments? Every time you touch yourself with presence and care, every time you give yourself permission to take time for your own pleasure, every time you prioritize your own satisfaction, you're answering this question with your actions. You're saying, "My life is mine, My body is mine. My pleasure matters. I deserve to exist fully rather than just functionally. This is revolutionary. This changes everything. Because once you truly believe that your pleasure matters in private, you start believing that your needs matter in relationships, that your voice matters in conversations, that your time matters when others make demands, that your boundaries matter when others try to violate them. You become someone who lives from the inside out rather than the outside in. You become someone who knows herself and refuses to abandon what she knows in service of keeping peace or maintaining approval. I have seen this transformation hundreds of times in my practice. It starts with small private changes in how a woman relates to her own body, and it radiates outward into every area of her life. Suddenly, she's speaking up at work. She's ending friendships that have become one-sided. She's asking for what she wants in bed with her partner. She's pursuing interests she had abandoned. She's setting limits with her adult children. She's creating a life that actually reflects who she is, rather than who everyone else needs her to be. This is not selfishness. This is self-preservation. This is the difference between existing and living. And it starts with the radical act of treating yourself as someone whose pleasure and satisfaction matter. Before we close, I want to give you a specific challenge for the next week. I want you to set aside 30 minutes, put it on your calendar, create a context that feels good to you, and practice the kind of mindful self-touch I've described. Don't worry about whether you have an orgasm. Don't evaluate your performance. Just practice being present with your own body, noticing sensation without judgment, and staying curious about your experience. If this feels too vulnerable or too difficult, start with something smaller. Take a bath and pay attention to how the water feels on your skin. Moisturize your body after a shower and really notice the sensation of your hands on your skin. Dance to music you love and pay attention to how your body wants to move. Any practice that reconnects you with physical sensation and embodied experience is moving you in the right direction. The goal is not perfection. The goal is practice, repetition, the gradual building of new neural pathways that say, I matter, my experience matters, my pleasure matters, I deserve to exist fully in this body and in this life. I want you to understand that this work is not frivolous or indulgent. This is essential healing work for women who have spent decades disconnected from themselves, performing for others, and believing that their value lies in how well they serve rather than in their inherent worth as human beings. You are not a role, a function, or a service provider. You are a complete person whose needs and desires and pleasure are just as valid and important as anyone else's. The way you treat yourself in private teaches you what you deserve in public. If you cannot give yourself presence, time, care, and pleasure when you're alone, you certainly cannot expect to receive these things from others. But when you learn to give yourself what you need, when you learn that your satisfaction is your responsibility and your right, everything changes. You stop settling. You stop tolerating the intolerable. You stop making yourself smaller to fit into spaces that were never meant for your full presence. This is what I want for you. This is why I've spent the last 2.5 hours talking with you about something as seemingly simple as masturbation, because it's not simple at all. It's the foundation of everything else. It's where you learn whether you matter to yourself. And until you matter to yourself, you will continue to give yourself away to people and situations that don't deserve you. So please take this seriously. Subscribe to this channel so you can continue this journey with me. Comment below and tell me what resonated with you, what challenged you, what you're committing to explore. Share this video with other women who need to hear this message, because I guarantee you know women who are struggling with the same patterns you are, women who have abandoned themselves for so long, they've forgotten who they are. Your pleasure matters. Your satisfaction matters. Your time matters. Your body matters. You matter. Not because of what you do for others, but because you exist. Start treating yourself accordingly, starting today, in your most private moments. Everything else will follow.